Assalamualaikum. Now another MSK station, that is Rickets. So opening state examination starts from the opening statement according to this opening statement. And one record the opening statement, this is 15 months Sakib, he has a difficulty in walking. So examine him. So we can start from the whenever we are confused, how should we approach, and should I approach to the general examination. So it's better said by different mentors that it starts from the gate. And just do the, you can follow my the previous recording, as we know that wash hand, introduction, taking permission, rapport, and then screening question, and taking a overall look, and then ask the child for the walk. During the walk we can see that there is a bowing of leg is present, and if we watch or observe the child very minutely, there may be double malleolus present. So after that we can check the back of Sakib, and there may be sometimes scoliosis may be present, and we can ask him to touch the floor. If he follow the command, okay, no problem. If not, and then as we get to the point is there is bowing leg and double malleolus, so we can focus on the regional examination. So we can check from start from the hand. In the hand there may be swelling of the wrist joint. So in the wrist joint we can start from the look, feel, as there is swelling, look, feel and move. And here we are looking and then feeling for the temperature and the tenderness, and then doing the movement of the wrist joint. Pronation, this is the supination, pronation, and ulnar deviation, and the medial deviation. And then as there is no tenderness, only the as there is no tenderness means that there is the bones deformity is present there. So after that we can start from the head to toe examination, and in the head to toe examination we can look at his head. There may be large head open frontally, and there may be alopecia and oral cavity. There may be delayed dentation, and check the chest in ricketic rosary present or not, and auscultate chest for any crepitation present or not. Abdomen may be distended. And to complete my examination, I want to do the vital sign, anthropometry, upper segment lower segment ratio, neurological examination, as there is going waiting gait was present, and do the developmental assessment, because here there is chance of motor delay. And then my diagnosis, it may be as there is bowing of leg present, and then this is rickets. And other causes of the bowing leg may be due to physiological bowing, skeletal dysplasia, Blount disease, neurofibromatosis, cerebral palsy, Sanjay-Sakati syndrome. So how would you like to investigate? For the investigation, first of all, the bone profile, serum calcium may be normal or low, or serum phosphate will be low, alkaline phosphatase will increase, parathermal will increase, and we can assay 25 hydroxy vitamin D3, and it will be low. And X-ray of the affected joint, X-ray of the wrist joint, there may be cupping, fraying, and increased distance between the epiphysis and metaphysis, sprawling present, and osteogenesis, osteopenia, and baseline investigation full blood count. And if we are suspecting this is secondary cause, we can discuss with consultant for the renal functional test, celiac screening. And how will you treat? I will go through take the focus history, go his previous notes, and run some investigation, and I'll go the management through the multidisciplinary team. And this multidisciplinary team, the team member will be pediatric consultant, dietitian, physiotherapist, occupational therapist, and liaise with school if he is school going, and support group, and I will keep him, will follow up and give him advice. And medical treatment depends upon, we can give straws therapy or gradual therapy. There is gradual therapy, so 6,000 international unit daily vitamin active vitamin in the form of vitamin D, inactive form of vitamin D we can provide for 6 weeks, and at the same time we can give the advice for adequate sun exposure and consumption of milk, butter, egg yolk, and we will keep advise the child for keeping the follow-up, adequate sun exposure, and avoid excessive exercise or contact exposed, as there is osteopenia and chance of fracture. And some other theoretical information. And for the history of the rickets or history of the bowing-less onset, course duration, and systemic inquiry, convulsion, cough, para-abdomen distension, delayed eruption, alopecia, joint pain present or not, history of dietary history, and adequate sun exposure present or not, and developmental history, allergy history, immunization history. And types of rickets, there is 5 types of rickets: nutritional rickets, vitamin D resistance rickets, renal rickets, hypoparathyroidism, parathyroid rickets, and systemic illness. So nutritional rickets, vitamin D deficiency rickets, vitamin D dependent rickets type 1 and type 2. Vitamin D resistance rickets, another heading, renal rickets due to CKD, and systemic illness just like the liver problem and or malabsorption. And there is one an investigation of rickets, that's the bone profile, ABG, renal function test, liver function test, X-ray, genetic test. And complications of rickets: short stature, recurrent chest infection, skeletal dysplasia. And there is another thing is that in case of medical treatment, usually nutritional rickets, we give the inactive form of vitamin D, and renal and dependent rickets, we give the active form of vitamin D. Phosphorus, we provide usually hypophosphatemic rickets, and ivory bisphosphonate we provide in the dependent cases. And there is another thing is that hypophosphatemic rickets. Loss of function of the various variants of the Phalanx gene and characterized by renal phosphate wasting mediated by excess fibroblast growth factor 23 activity. And hypophosphatemic rickets is characterized by hypophosphatasia, slow growth rickets. Burosumab is a monoclonal antibody, is a newer option for the treatment of hypophosphatemic rickets. Thank you. Assalamu alaikum.